You do not begin in an operating theater. You begin with an ambition that sounds exciting long before you understand the responsibility attached to it. At school, you learn that talent alone will not carry you. Every exam result becomes another small test of whether the dream is realistic. You study late while friends switch off for the evening. Biology, chemistry, and endless revision slowly become part of your normal life. Medical school finally begins, and the excitement is immediate. So is the realization that nearly everyone around you was also top of their class. The first anatomy lesson changes how you see the human body. It is no longer an illustration in a book, but something complex, fragile, and real. You spend years learning diseases, medicines, and clinical skills. The volume of information feels impossible, yet patients will eventually expect you to remember it. Your first hospital placements make medicine feel real. You follow doctors through busy wards, trying to observe everything without getting in the way. At first, even speaking to patients feels intimidating. You learn that listening properly can matter just as much as knowing the correct medical term. You witness your first operation from the edge of the theater. The calm precision of the surgical team makes the room feel unlike anywhere else. You are drawn to the focus, teamwork, and immediate problem solving. Surgery begins to feel less like one option and more like the path you want. After graduation, you become a newly qualified doctor. The title sounds impressive, but the responsibility feels much heavier when your decisions affect real people. Your early shifts are filled with ward rounds, paperwork, and constant questions. You quickly learn that hospital medicine involves far more than dramatic emergencies. Night shifts test your confidence when senior support feels further away. Every phone call forces you to decide what is urgent and what can safely wait. You deal with frightened patients, exhausted relatives, and overstretched colleagues. Remaining calm becomes a skill you practice every day, even when you do not feel calm. To enter surgical training, you build experience wherever you can. Courses, audits, research projects, and extra theater time compete with an already demanding job. The competition is intense because many doctors want the same limited posts. Rejection becomes part of the process, even when you have worked hard enough to deserve a chance. Eventually, you secure a surgical training position. The celebration is brief because the real challenge begins almost immediately. Your days often start before sunrise with handovers and ward reviews. Before entering theater, you must understand every patient, every risk, and every unresolved problem. In theater, you begin with basic tasks under close supervision. Holding instruments correctly and closing a wound neatly suddenly feel enormously important. Your trainer watches every movement and asks why you made each decision. Surgery demands not only technical skill, but the ability to explain your judgment. Progress comes slowly through repetition. A procedure that once felt impossible becomes familiar, although confidence can disappear the moment something unexpected happens. Not every operation goes to plan. When bleeding starts or anatomy looks different, the room becomes quieter and every decision matters more. You learn that asking for help is not weakness. Calling a senior surgeon early can protect a patient far more than pretending to be certain. Some days, you leave theater proud of what the team achieved. Other days, you replay every step, wondering whether you could have done something better. You also spend long hours in clinics explaining diagnoses and options. Patients often remember your honesty and tone long after they forget the medical detail. Before major surgery, you explain risks that nobody wants to hear. Consent is not a signature. It is making sure someone understands what they may face. Emergency surgery brings a different pressure. There's little time, limited information, and a patient whose condition may worsen while the team is deciding what to do. You scrub in knowing that the operation could save a life. You also know that skill cannot guarantee the outcome. Sometimes the patient recovers quickly, and relief spreads through the entire team. Those moments remind you why the years of training felt worth it. Sometimes complications develop despite everyone's best efforts. You must speak to families honestly while carrying your own disappointment in silence. A surgeon's work continues after the final stitch. You review scans, monitor recovery, and respond when a patient's condition changes unexpectedly. You learn to recognize the subtle warning signs of infection or internal bleeding. Acting early can be the difference between a manageable setback and a crisis. Training exams continue throughout your career. You revise after shifts, On weekends and during moments that once belonged to rest, the job places pressure on life outside the hospital. Birthdays, evenings, and family plans are sometimes interrupted by emergencies or delayed operating lists. Fatigue becomes dangerous if it is ignored. You learn that concentration, communication, and safe decisions are harder when your body has reached its limit. As your experience grows, younger doctors begin looking to you for answers. You recognize the same uncertainty you once tried to hide. Teaching becomes another part of the role. You guide trainees through procedures while remaining ready to take over the instant a patient's safety is at risk. Eventually, you complete years of specialist training and become a consultant surgeon. The new title brings independence, but it also removes many of the safety nets. Now, the most difficult cases are often referred to you. When the team needs a final decision, the room turns in your direction. You lead operating lists, clinics, and multidisciplinary meetings. A large part of surgery is coordinating people, information, and resources before touching a scalpel. You also face complaints, investigations, and difficult reviews when outcomes are poor. Accountability means examining mistakes openly, even when doing so is painful. The best surgeons do not believe they are infallible. They keep learning, question their own habits, and respect every member of the team. Over time, individual patients stay in your memory. Some are remembered because they survived, while others are remembered because they did not. The career can bring pride, purpose, and extraordinary moments of trust. It can also bring exhaustion, sacrifice, and decisions that follow you home. Life as a surgeon is not simply about operating. It is the lifelong responsibility of making precise decisions while another person's future rests in your hands.